Welcome, everybody, to another edition of the Scoliosis World. I'm Dr. Mark Morningstar, of course, your host. Thank you for tuning in this week. I'm really going to be talking this week. The topic for the podcast this week is spinal fusion surgery for scoliosis. Now, I know probably what a lot of people intrinsically think. Okay, we got Morningstar on here, this chiropractor. You know, he's going to be bagging on surgery because he is a chiropractor, so of course he's going to be against surgery. Now, to put all of that to bed, I am not against spinal fusion surgery, okay? There is absolutely a time and a place where surgery needs to be performed. We refer for surgery very commonly in our office because it's necessary in some people. However, what people have to bear in mind, and what the crux of this show is going to be about today, is sort of having a little bit of a debate on when that surgery should be performed, and the fact that the surgery is not without its potential repercussions of its own. And so I'm going to dive into that because I feel like if there is a downside, or the one thing I am against with regards to scoliosis fusion surgery, is that I don't feel like parents are given all of the information about it. I feel like it's sort of put out there as, well, your child's curve is 50 degrees now, so we're just going to do the surgery. And there's really not much else in the way about it explained. We're going to do this surgery. It's going to cut your curve in half. If you won't have any restrictions, you'll have this X amount of recovery time, and so on and so forth. And in many cases, it's sort of put forth as kind of like a solution, or once a surgery is done, you're not ever going to have to worry about your back again. Unfortunately, that's just not true. And again, this isn't to disparage all surgeons either. It's just the reality is people have the right to have full informed consent before they receive any medical procedure. I don't care how benign or invasive it is. And so one of the key things with scoliosis fusion surgery or spinal fusion surgery is that they're under the normal current criteria. Somebody is a surgery candidate if their curve reaches 50 degrees. Now, there are still some surgeons who will do it at 40 or 45. But technically, as of now, 50 degrees is that threshold. And that's what we use here in our office. Now, just because somebody's curve reaches 50 degrees doesn't mean that they have to have surgery just because it hit 50 degrees. There are a lot of factors in decision making that has to be involved in deciding whether or not a child should have surgery. It's not just, oh, well, you're at 50, so let's do surgery. I think the biggest thing with any medical procedure, and in this case, I'm not even just referencing scoliosis fusion surgery, any medical procedure, if you're going to do it or receive it, has to have a medical reason as to why that procedure is being administered. For example, if I have a bacterial infection of some type, let's say I have a staph infection in my foot. If I don't do something about it, I'm probably going to go septic and die, right? There's a very good chance of that. So I'm receiving treatment because if I don't, the outcome is going to be worse than if I do. And there is a definitive medical reason. Now, that's an easy example, right? But when you go to something like spinal fusion surgery, that line is not so crystal clear. There's a lot of gray area in the decision making for idiopathic scoliosis patients receiving spinal fusion surgery. And I would argue even more gray or grayer in neuromuscular scoliosis cases. And I'll explain that to you in a little bit. But one of the things to understand is that if I myself, and I believe anybody should be this way, if I'm going to make a recommendation that one of my patients consults with an orthopedic surgeon to do scoliosis fusion surgery, I need to make sure that that surgery is addressing a medical indication. Because let's face it, a curve by itself is not a medical indication. It's not. That curve by itself does not necessarily mean that there is a health problem attached to the presence of that curve. And here's why. Dr. Stuart Weinstein, who is an orthopedic, very prominent orthopedic surgeon, published a study where they followed patients for 50 years. And this was published in the Journal of the American Medical Association back in 2007. So again, a little bit older data. But they showed that in people who have scoliosis and literally did nothing for their curves, basically their whole lives, that when they compared those patients now in their 60s to other 60-plus-year-old patients who did not have scoliosis, what they found is that their pain and daily function were basically the same, whether they had a curve or not. So I would ask, if that's true, what does the presence of a curve by itself mean? So I have a curve. So I don't look picture perfect. Who does? I don't look perfectly symmetrical. Who does? Right? Fixing a curve for fixing a curve's sake is one thing. But when the solution has a lot of risks involved with it, and still to this day, undetermined potential consequences of that procedure, people have the right to know that information before they make their decision. And they shouldn't be disparaged for not choosing to have scoliosis fusion surgery because they know that information. So for example, there was a letter to the editor written in the Journal of Pediatrics in 2018, and I'll have the producer here put it up on the screen for you, written by 4 orthopedic surgeons. And what they were doing is they were responding to a study where they were showing what the healthcare costs associated with spinal fusion surgery were in terms of hospital costs and so forth. However, they made some other, and I'm going to read right from their letter to the editor. And again, I'll put it up on the screen, and the part that I'm going to be reading is highlighted in yellow. First, the necessity of correcting adolescent idiopathic scoliosis with expensive implants should be reconsidered. Whereas a traditional notion is that curve progression has a negative impact on the young with idiopathic scoliosis, the natural history of idiopathic scoliosis is more optimistic than imagined. Based on an average 50-year follow-up study of 117 untreated patients with idiopathic scoliosis, Weinstein et al., who I just mentioned, demonstrated the productive and health natural history of idiopathic scoliosis patients. Even if a curve progressed to some critical extent, the deformity did not affect their daily life and welfare of these patients. Consistent with that line of evidence, Yaze et al., different study, and I'll go over that one in a second, noted that only severe thoracic scoliosis curves of greater than 80 degrees affected pulmonary function, meaning lung function, with thoracic kyphosis as a predictor, and I'll go over that as well. Scroll down a little bit. Strikingly, adults who were treated surgically for fusion, meaning they had fusion surgery as children, have lower physical activity levels as adults than patients who were not treated. Second, the adverse effects of spinal fusion surgery should be considered. There are not only adverse events during surgery, and I'm paraphrasing here, such as the need for blood transfusion or massive bleeding, but also major health effects, including radiation exposure from repeated whole spine radiographs. Moreover, the long-term, lifelong preservation of metal implants triggers both local and systemic bodily reactions with increased metal ions in the serum, meaning the blood, and hair. Collectively, we suggest that surgical treatment for adolescent idiopathic scoliosis be reconsidered for the welfare of adolescents rather than distributors, meaning the companies that make the hardware. I'm going to boil all that down. In other words, because they know that as a general rule of thumb, scoliosis doesn't cause a real organic health impact until it reaches 80 degrees in the vast majority of cases, Why shouldn't we be waiting until 80 degrees until we consider scoliosis fusion surgery for patients? Because let's face it, I'm going to be very blunt here. If there is no organic health reason to have spinal fusion surgery, the only reason you're having it is cosmetic. And that's just pure and simple. And now it becomes a very, very expensive cosmetic postural surgery that is not without its consequences. Now, they referenced a couple studies in here that I want to get to. Yaze et al. is one of them. And that study is the effects of the three-dimensional deformity of idiopathic scoliosis on pulmonary function. So I refer over to that study. This was published in 2017 in the European Spine Journal. Again, one of the most prestigious orthopedic journals there is in the world. And what they basically said is that in curves greater than 80 degrees, thoracic curves greater than 80 degrees, and in patients where their thoracic sagittal curve was decreased, those were the patients who were the most likely to have a lung impact. Now, let me give you a little bit of background information on that. So when I talk about the sagittal thoracic kyphosis, we are born, and when we're in utero, in a fetal position, we have a natural thoracic curve. In other words, if you look at me from the side, I should have a natural backwards thoracic curve in my mid-back. Those natural curves, so a forward curve in the neck, backward curve in the mid-back, and then another forward curve down in the low back, are what we call your physiologic curves. Those are the curves that allow for function and movement while at the same time adapting to gravity and still being strong. So it gives us sort of a balance between being both strong, meaning being able to adapt to gravity, and functional or flexible. Without those normal curves, normal spinal function cannot exist, period. So what they found happens, and I've referred to this in previous podcast episodes. Some people, if it gets significant enough, they will call it a flat back deformity. But when you lose that normal thoracic curve, it's easier for a thoracic scoliosis to become more progressive. And it also makes it harder to correct that thoracic scoliosis unless you specifically address the flat back issue or the decreased thoracic kyphosis. And whether you handle that surgically or conservatively, even in my patients, when I'm doing initial x-ray reviews with a prospective family, if there is a presence of a decreased thoracic kyphosis, I will always tell them that this has to be priority number one in the process of fixing your child's back. Otherwise, no exercise, no brace, no activity suit, nothing will have the chance to fix this curve on a long-term basis until we improve that thoracic kyphosis. So sometimes you have to do a little bit of foundational work in order to be able to fix a scoliosis curve on a longer-term basis. And so they were just denoting in this study from Yaze et al. That it's not even necessarily just the curve being 80, the thoracic scoliosis being 80 degrees. It's also if they had that decreased thoracic kyphosis or flat back. Those are the times where now it causes decreased lung function. Now, if you have decreased lung function and you can document that objectively, guess what? Now you have a medical indication to have scoliosis fusion surgery, which I am fully on board with. And we do it here all the time. We send patients out because it doesn't necessarily have to be 80 degrees. If there are patients who really feel like their lung capacity is impacted by their curve, I am more than happy to send them for pulmonary function testing to see if they have decreased lung capacity or some type of compromise in lung function. If they do, now we've established a medical reason to consider a surgical option. Now, they also mentioned, and I'll refer back to it here, but Zhang and al. In the editorial, that again, they mentioned that there's an accumulation of metal ions in the blood and hair of patients who've had scoliosis surgery, fusion surgery. Now, in a short-term one, this one is serum titanium, niobium, and aluminum levels after scoliosis fusion surgery. Paraphrasing, but I'll throw this study up here. It's in Spine, the journal Spine. Again, one of the more prominent orthopedic journals, and this one's in North America. Again, I'm going to read you the highlights. 32 patients included in the group. Average age at surgery was 14 years, 7 months. Pre-operative and post-operative concentrations of blood levels of titanium and niobium were significantly different. Titanium was 2.4 times above the normal range, and niobium was 5.9 times above the normal range post-operatively. This was elevated, this elevation persisted for a year after the surgery. Now, here's one of the things that happens, right? Is they only followed up for a year. They didn't follow up for longer than a year. So who knows if they're still in their blood 2 years later, 3 years later, 5 years later. But at some point, here's what happens. The body cannot have titanium, niobium, and aluminum levels circulating in the blood forever. At some point, as those other metallic ions start to disrupt the pH and other factors associated with blood plasma or blood serum and health, your body will shunt those metals into different tissues to be stored so that it's not circulating in your bloodstream. Now, those metals might be stored in bone tissue or kidney tissue or brain or heart or other organs and be stored there because the body says, I can't have all of this stuff running around in my system. In a different perspective, I'm here from Michigan, right? We had the Flint water crisis here going on forever. Well, even now, one of the things I find very unfortunate in certain ways is that they advocate blood lead testing for the Flint water victims. The problem is, even if blood lead testing, meaning serum lead testing, looks normal, that doesn't necessarily mean they don't have stored lead in their organ tissues from drinking the contaminated water all this time. But the problem is there's a different way to check that than to just check blood levels. So, but that persisted for at least a year. And we don't know if it was longer for a year because they stopped evaluating after a year. They checked at 1 week, 1 month, 6 months, and 12 months, and then they stopped. I would be very, very curious to know, had they continued checking, how long it would have still been elevated for. And again, that was Spine in 2013. Then, as part of that, so to back up on this a little bit. So when people get scoliosis fusion surgery and they have those titanium rods and all the implant hardware, what you have to understand is that it's referred to as a titanium alloy. And what that means by virtue of the term alloy is that it's not just titanium. It's a combination of metals, not just titanium. Titanium might be the predominant metal, but it's not the only one. In it, you're still going to have things like niobium and aluminum and cobalt and chromium and so on. And so it's not enough to just check titanium because that's not the only thing that could be elevated. And in fact, they have tested this. The same lead author who checked the titanium, niobium, and aluminum levels in the 2013 study also published a study back in 2010 titled Chromium Ion Release from Steel Pediatric Scoliosis Instrumentation, meaning the implant hardware. And again, what they found is that raised serum, again, meaning blood levels of chromium, were detected in 37% of patients following scoliosis fusion surgery. Now, I'm going to read you what he goes on to, or these authors go on to say in their conclusion. This new finding has relatively unknown health implications, but has potential mutagenic, teratogenic, and carcinogenic consequences. This is especially concerning with most scoliosis patients being adolescent females with their reproductive years still ahead. Probably the most important conclusion I've read in a while, most impactful, right? How many parents are ever told, look, the titanium we're putting into your child's body, we have no idea what it's going to do to them in reality. Yes, we're going to correct your curve, but these are the health consequences that your daughter might have because we put this hardware in her body to correct this curve. That wasn't even causing a health problem, right? Now, again, I understand if there's a significant lung issue because of the curve. You obviously have to have normal lung function, because if you don't, there are studies out there that shows decreased lung function is equated with a decreased life expectancy. So again, I understand that. And that's, to me, also when I agree with having the scoliosis fusion surgery. Short of that, I'm not so sure that the benefits of the surgery to correct a curve that's not really impacting that person in any appreciable manner is worth the potential consequences. And this isn't my information. And sadly, this isn't new information. This information is 15, 16 years old almost. So and parents don't get this information. Now, so that was, they followed up with these patients 3 years after their surgery to find that the 37% of the patients had elevated chromium levels. And that was 3 years after their surgery. So, all right. Then different set of authors, Lucia Savarino and her colleagues, let's see, long-term systemic metal distribution in patients with steel spinal instrumentation. This is 2015 in Journal of Spinal Disorders and Techniques. And again, they also looked at chromium. They looked at chromium and nickel. Again, one of the other metals in titanium alloy. The minimum follow-up was 10 years. Chromium and nickel levels were measured and compared with a control group, including 30 healthy subjects. What they found is that a high specificity and significantly increased levels of chromium in patients compared with control groups. Not for nickel. So in other words, 10 years after scoliosis fusion surgery, scoliosis fusion patients still have elevated levels of chromium in their blood. And I already mentioned chromium was at least present for a year. Well, a different group of authors picked right up where we left off. None of the authors are even the same authors. And guess what? 10 years later, and I'll have the producer put these up on the screen, obviously. 10 years later, chromium is still elevated. Well, elevated chromium levels can be a problem. Chromium has impacts on insulin sensitivity. Chromium, obviously we need chromium in certain senses because chromium is one of those trace minerals that we actually need. But the problem is if it gets too high, it becomes mutagenic. It becomes potentially carcinogenic. It becomes potentially teratogenic, which means the development of tumors. That's disgusting. But how many parents actually get that information? I don't know. But I can tell you that when I give this information to my patients, even patients who have already been in a surgical consultation with a doctor, I haven't had a patient yet tell me that they heard this information. Not one. Now, I can guarantee you it's probably in a 3-point font on an informed consent form that they're going to sign and probably not read because it is in a 3-point font. But they're never given this information verbally. It's, we're going to do this surgery. You're going to recover in X amount of time. You're going to be back to school or back to your activities in X amount of time. And we're going to follow up for X amount of time. But that's it. They're really just talking about the process of the surgery. They're not talking about the health implications of having the surgery. Nobody discusses that. Nobody. And that's to me, If you want to have true informed consent, you have to discuss these things with patients. Patients and their parents have a right to know this stuff. And to me, when you know things like this happen or can happen, it's all the more reason why you want to try to do everything you can short of surgery to deal with the problem first. Because you know what? Let's be frank. Who doesn't need to exercise more? Who doesn't need to be more active? We all do. We're all sedentary. It's our lifestyle nowadays, right? Kids with a curve, young teenagers with a curve, young adults with a curve. We all need to be more physically active. It's just their physical activity can also be designed to be helpful for their scoliosis. Why wouldn't you want to go that route before considering something like this and all of the potential problems that this kind of a surgery can cause? Now, there are alternatives to spinal fusion surgery now, like vertebral body tethering, and I am a big fan of vertebral body tethering. But again, it's still a major surgery, and you still have to consider what are the long-term potential risks of having any major surgery. That's all. Even though I much prefer that surgery over spinal fusion surgery, and again, refer for it, I should say, much more commonly than I refer for spinal fusion surgery. And some of that's due to availability in the United States here. There aren't that many physicians in the United States who perform vertebral body tethering compared to fusion surgery. But I believe someday that will be a generational changeover, and all of a sudden every surgeon will just be doing tethering because, frankly, it's just a way better procedure. Unfortunately, in 2026, not everybody has access to that surgery yet. So, if you're considering spinal fusion surgery because you were told your child needs it, ask more questions. Get this data. This is all on PubMed. This isn't data I made up. You can find all of this information online. You just have to know where to look. It's sort of like you can't have true informed consent if you're not given the information. I'm not telling you to have the surgery. I'm not telling you to not have the surgery. What I'm telling you is if you're somebody who is looking to make that decision, arm yourselves with the information so that you can make a proper informed choice for you, or more importantly, for your daughter. You don't want the long-term potential effects of some of these things to affect your daughter, or more importantly, maybe someday your grandchild. Think about that as well. So that's my spiel for the week. I hope this information is eye-opening for some of you, at least enlightening for all of you. If you like the Scoliosis World podcast, please subscribe to Scoliosis World. It is growing by leaps and bounds, so I do appreciate all the views and all the people who are consistently tuning in. I sincerely appreciate you. And I hope to just keep bringing you evidence-based topics every week. Again, evidence-based topic. I'm just bringing you evidence. And again, unfortunately, with this particular topic, this isn't evidence that's new, and it's been out there for a while, but yet people still don't have access to it. People still aren't getting this information in day-to-day clinical practice, at least from my experience and in my communications with my patients who've had surgical consults. So please arm yourselves with this information. If you have any questions about any of the information on our episode today, you are more than welcome to reach out to me directly. You can email me at mmorningstar. That's two M's, MMORNINGSTAR, down at the bottom of the screen, at backgenius.com. You can also find my personal scoliosis practice, which is just scoliosispractice.com. And you can reach out to me in either or both of those methods, and I will be happy to do a free phone consult or an x-ray review with you to see if maybe you want to consider an alternative to what you've been given. So with that for the week, I'm out. Dr. Mark Morningstar. I hope you keep tuning in. Thank you again for tuning in this week. We'll see you next time.